Good morning, CIMAR Community Health Center. Buenos días, señor, ¿en qué le puedo ayudar?
Every day here at CIMAR, we do a little bit of everything from healthcare to dental care to actually helping people get eligibilized for Medicaid, for Medicare, for Social Security, for a whole bunch of social programs. For us, it's like turning on little miracles for people. Anytime that you can get someone access, to a clinic, to a doctor, to a physician, to a dentist, it's a miracle for them.
The people who come to our clinic face several barriers to getting health care. Oftentimes they don't speak the language, and we provide both physicians and other staff that speak Spanish, Laotian, Cambodian, or Vietnamese.
Entonces, todavía no tienen cita con WIC.
Because of the fact that we have bilingual, bicultural staff and providers, we were able to give them that sensitivity. I think we are providing that need, that access to the population that just isn't being met.
Bien, ¿qué más? ¿Usted tiene otra preocupación con el niño?
We define healthcare in the broadest perspective. We see health as part of a total social picture for our patients. And so we see the individuals who we take care of, their families, in terms of where they live and how they live. For us, it's very important that they have heating to keep them warm in the wintertime, that they have adequate nutrition. So we have a supplemental food and health education program, a nutrition program. We also provide access to a variety of different programs that are not only medical care, but also include mental health services, dental services, home health services, and the complete spectrum of preventative services.
Our programs are comprehensive, affordable, and culturally sensitive. Education is also a very important part of the services we provide at CIMAR, whether it's at our student health center or in our residential substance abuse treatment center or in our family counseling services or rural outreach services.
At the camps, for instance, you will find the health educator working in very creative ways to teach the children how to brush their teeth and what are the healthy foods that they ought to eat. With little things like teaching a kid how to pitch her teeth properly, the impact in later on in life is very great.
¿Cómo es que podemos cuidar los dientes? ¿Cómo?
Brush your teeth.
Brush your teeth. That's very important. Es bueno para los dientes porque tiene mucho calcio que hace que estén bien fuertes.
The Homeless Outreach Program at CIMAR is wonderful. We have a wide range of services that are available. We can usually help with housing, somewhere, a place to eat, get a hot meal, or get a food basket, to take a shower, get a haircut, because you can't get a job if you're not clean and presentable, and you can't get a job if you're not rested. So we try to coordinate all those resources for our homeless and our migrants. CIMAR is more than just a medical clinic. We're there to provide medical services, dental services, anything that's going to help the patient or the client improve the quality of life in order for them to survive here in this foreign environment.
We do see ourselves as advocates for the people whom we serve and for the community. We don't just sit and wait for people to get sick and walk through the front door. So we actually advocate for all of their needs.
CIMAR has always been visionary. They have provided state-of-the-art care at the highest quality that they've been able to maintain for the elderly and low income. About 10 years ago, they realized they needed to expand into the nursing home type of care because so many of the Hispanic elderly had nowhere to go where they could continue to eat the food that they're used to and to have someone to understand them when they speak their language.
We did notice that the elderly folks in our community were having difficulty getting culturally appropriate nursing home beds, and the children were having difficulty getting the care that they needed in appropriate daycare settings and Head Start programs. So, responding to the need of the community, we became excited about the idea of an intergenerational care program where we could really have the very young and the elderly spending time together, helping each other learn. It gave an opportunity for the elderly to pass on information about their own cultural history to the very young, and we thought that that was a very beneficial thing for both ends of the age spectrum.
Okay, you want to go to the nursing home?
Yeah! When you bring them back together in a situation such as this, they're able to work together, play together. The elders often help the children with their manners and all kinds of concepts that kids are learning. The people that are working in between, at my age, your age, they learn too, and so it's like bringing family back together. Especially here at CMAR, where many of our people are from the Latino Hispanic background. This is in their culture, keeping family together, and so we're doing what is needed at this time.
Un elefante se columpiaba sobre la tela de una araña. Como veía que resistía, puedo llamar otro elefante.
The idea of cultural continuity is very critical, and we find that it's very helpful and very unique for someone to actually be employed here at CMAR, and to not only have their children be in the daycare center, but also to have a parent in the nursing home. And this allows for a lot of family contact and continuity of care.
Willoughby, wallaby, woo, an elephant sat on you. Willoughby, wallaby, wee, an elephant sat on me.
Ultimately, CMAR is accountable to the community that we serve, and members from the community serve on our board of directors and help us plan our policies and help us assess the needs and develop the programs to meet those needs. So if the community has the feeling like we need to provide more obstetrical care, then those things are put into place. It was in part from support of the community and the idea from the community that the intergenerational care facility also became a dream and now is a reality.
CMAR offers a residency program in family medicine, which is run in conjunction with Providence Hospital. Now, this program is a nationally recognized model for teaching both family medicine as well as community health for young physicians. We expose young physicians to the community and to their needs. They get first-hand training here. And so at the end of the training, most of them will stay in the community, and some of them have been staying here at CMAR, and we are really proud of that.
What we have done is we have trained some students that are bilingual, bicultural, to be dental assistants, and now they work with CMAR, and we're very happy for that because they provide that mentorship, role model for the migrant workers that come in here. They relate to them, and they feel very much at ease with that.
Most of the people that I have here are a farm worker background, and that gives you an extra asset that other clinics don't have. I have people that have gone through the fields, that worked with the same people that we're not serving, and so that gives you that additional commitment, that attitude to serve people as if they were, members of our own family.
We're not just a clinic. We're family, we're friends, we're their healers. Maybe sometimes we're the only contact outside of their culture in this area that makes it nice for them, or makes it a nice welcome to come here. We get invited to baptismals. We have babies that are named after some of the employees, some of the doctors. That says a lot. That says a lot about what people think about us as a clinic.
Working at CMAR is a very exciting experience because you see a variety of things. When I hire an employee, I tell them, come on and join the ride with me. It's going to be like riding a roller coaster, but it's going to be fun.
In private practice, I just don't think that I would get the satisfaction that I'm getting here.
And we're all in it for the same thing, to help the people, to help our culture, to help the heritage. But not only for the Latinos, because CMAR has grown. We have your Russians, the Croatians, we have the Asians, we have East Indians, the Hindus. It's like a bouquet of people.
It also helps me tremendously to know that my assistance to a child, an elderly woman, a family, is of some value down the road. You make somebody happy.
Yeah, la familia. That's what it feels like.